to www.agelesshealth2012.com for your special invitation.
Dr. Tom Roselle live right now on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio. It is another wonderful day in the metropolitan area, and guess what? I'm here for your calls, 888-630-9625, 888-630-WMAL. Love to talk to you on any subject that you have in mind. Perhaps you've had a problem, you've tried, you've applied. Maybe I can put the light in a different arena. Maybe something that actually will work, that would make a difference and help you get rid of whatever chronic situation that you've been dealing with. We have a topic today, one that is very fascinating, one that is confusing, one that many of you have taken upon yourself to do a little investigation with. But guess what? I've got an expert in the field with me. I've got somebody who really knows this stuff inside out, upside down, and can really show you how. And that's what the topic is going to be, by the way, this Wednesday evening at the Roselle Center for Healing, the 19th of the month at 7:30 p.m., continuing our in-house continuing education series. Dr. Stephanie Pina will be your presenter, and my guest today, Dr. Pina. Good afternoon.
Good afternoon.
So we're going to talk about herbs. Dr. Pina.
Yep, we're going to talk about basically a lot of people, like you're saying, are finding out more and more interest and information about herbs, whether it's on the internet or reading books, or they're seeing much more herbal use out there, and there's more access to it thanks to some of the stores now that kind of sell different forms of it. But you see it all over the place, and a lot of people think if I go get that one herb or this formula of herbs that I'm going to be all set, my problem's going to go away because it says so on the label. But there's some issues we should know about it and then understand it a little bit more.
It's like anything else, whether it's an herb or if it's a homeopathic or if it's an enzyme or if it's a vitamin. Not one size fits everybody, but particularly with herbs. And there's the differentiation. I'm going to get into it with you as the program goes on. And we're talking about Western herbs, we talk about Chinese herbs, we talk about hot herbs, we talk about cold herbs, and they do different things in the body. And for somebody just to go out and say, I want this herb because I think it's, for example, ginseng. Ginseng is supposed to be an aphrodisiac. It's supposed to be a hormonal balancer. It's supposed to be something that gives you energy and strength, and it takes away the fatigue. But the problem is that if you hit the wrong type of ginseng, you actually can make things worse for yourself. So we're going to talk about that and the balance of that. And 888-630-9625 is how you ask any question on the subject. But herbs are things that you can do and you need to know about. And Dr. Pina will be your presenter this Wednesday. If you'd like to attend this program and learn how to actually apply these things. So if you can't get in to see us, if you're in a bad situation, you got a cold, you got intestinal tract problems, you want to find out how herbs work together and what the right herbs are. Wednesday night, 703-698-7117, 703-698-7117, and tell my staff that you'd like to attend Dr. Pina's presentation on understanding herbal medicine. Let's talk a little bit about understanding herbal medicine. I mean, it's a big subject, and it's a balance. It truly is. So, tinctures and teas and infusions and poultices and all these things, it's confusing. Where does somebody start?
Well, the interesting thing is that it probably won't get even less confusing after one little lecture, because this has been going on for thousands and thousands of years. I mean, they have history back to the Egyptians where they're seeing them using herbs. They have history from Chinese herbal medicine being over 2000 BC, they're using herbs. So a lot of this information has been gathered over time, so different herbs have kind of been used for different purposes for a lot of different things. I mean, they talk about now, out of the Western herbs that we typically are used to now, there's like 119 plants that are derived that make pharmaceuticals. And out of all those plants, about 74% of them still have a relationship between their modern day use and essentially their traditional use, or how they were used way back when, from herbalist or shamanistic principles and stuff like that.
Well, what people need to really understand is that herbs are medicine, period. And it's not just, some very, very low-dose vitamin that, as you just said, most of our Western medicines are derived from herbal preparations. And when you take the herb itself, these herbs have an impact pharmacodynamically, physiologically, just like a medicine does.
Absolutely. And then when we talked about the different forms that are out there, the tinctures and teas, and when you go to the store and you see these different forms, they're going to be a little bit different than, say, someone who decides to pick up chamomile tea in the tea section versus someone who's getting, a compounded version of it as a tincture version. It's going to be a lot stronger, so we have to know when's the best time to use both of those types of products.
Now, there's a controversy within the community of herbalism, if you will. I've used herbs my entire career with patients, and we used to make them in the office. We used to put them together for different types of problems, but it got to the point where it was just too cumbersome, so we started to go to very specific companies. But there is that balance. Which is better? Do we want to use extracts? Do we want to use the whole plant? Do we want to use a tincture? And those are different things. How do you divine that? And we also know that herbs are individualistic. They can be very specific for the person, and if you give the wrong herb to the wrong person, it doesn't work the same.
Absolutely. And that makes it really important to have someone who knows what they're doing with the herbs when they are trying to mix them up. You look traditionally and you'll see a lot of people would use the raw form. So they would send forms, like basically you get a bag, like in Chinese medicine, roots and twigs and leaves and everything. And you go home and you make a tea out of it. You're much more involved with the whole process than getting just a capsule and then swallowing it. But essentially when it comes down to mixing versus getting something that's standardized, there's pros and cons to each one. Obviously companies that are putting stuff out now, the more professional the company is, the more they're going to put standard extracts on there. So they're going to say, this particular herb has this much of this active component in there. And that's nice when you're giving the herb for that particular reason. But a lot of things that we forget about when we give one individual herb or certain product formulations is that the herbs work together. There's a synergy that's really important.
888-630-9625, 888-630-WMAL. Love to talk to you on herbs or any other subject you have in mind, or if you'd like to know how herb works with your particular condition. And here's the situation. This Wednesday evening, Dr. Pina is going to get very in-depth into how to put these things together. What she's going to talk about is if you're in a crisis, if you're in a specific situation, what herb can I get if I can't get to see my doc? And will it counteract, it will contradict the perhaps medications that you're taking? And the truth of it is that you have to understand the side effects, because some herbs do counteract medications or enhance them, intensify them. So you really need to know the balance. This is a great class. It's one that you really get Herbal Medicine 102, because we did 101 before, and to be able to say, okay, I need to have these things in my home apothecary so I can use them. So give our office a call at 703-698-7117, 703-698-7117, and tell my staff that you'd like to attend and call us here, 888-630-WMAL, and we'll answer any question that you have on this subject or anything else. Dr. Pina, let's talk about the different preparations. Let's say, for example, let's get into specifics. Somebody has a problem like what's going on right now. There's a lot of people out there that are having intestinal tract problems, a lot of cramping. They eat something and it runs through them, and they're hitting the porcelain throne maybe 7, 8, 9, 10 times a day or more. And this thing seems to be lingering anywhere from 10 days to up to 3 weeks or so, where the residual's there. How do we know, number one, that herbal medicine is the best way to go with this, and instead of going to the doc or taking Lometril or any of the things that will quiet the gut down? You've seen a lot of it. I've seen a lot of it. Talk to us a little bit.
Well, what's interesting in this particular situation versus, say, if it was the cold flu season or allergy season, is that when you're working with digestive disorders, you have to be careful of how you take that herb, because it has to be digested in your digestive tract too. So if you're constantly moving things quickly throughout the digestive tract, you don't want to have something that's going to necessarily irritate the stomach even more to be in there. Some of the heavier herbs, even the tincture sometimes, even though they're stronger and they're more potent, you want to make sure if you're taking something strong, it's over a shorter period of time. In those situations, things like teas are actually going to be a little bit more better because they're calming to the stomach. That warmth is going to help kind of break down some of the foods that you do have. Hopefully at that point you're eating something that's a little bit more simplistic and not going after a big greasy burger or anything. So that's not going to exactly help, but you want foods that, and also herbs that are going to help tonify the stomach to help keep some of those nutrients and fluids in as well.
It's it's funny, in dealing with this problem that's been out there, there's really only been like 3 or 4 herbs that have an effect, have tested well for people who are suffering from this. And one of them is an herb called UDG, or Uña de Gato. It's an herb that's been around for a long time. Golden Seal seems to be testing as well, but that gives us a double-edged sword. It tells us that it can be this bug out there is manifesting itself in a couple different ways. Talk to us a little bit about UDG.
Well, it's an interesting herb because essentially it is a long-term herb. It's more of an South American herb that essentially, when it goes into the digestional tract, it's kind of looking for those little buggers that might be causing some of the issues and kind of makes the environment not so good for them. It's not necessarily changing the pH of the stomach, but it's just not making it good enough for them to hang around. So essentially, they're going to go out through the digestive tract. And in the meantime, it's going to allow some of those tissues to heal that have been kind of inflamed around there. The immune system, obviously, is going to be boosted, too. So if you're having any side effects that are along with that, like any fever, chills, muscle aches and stuff that can be from either the bug itself or from the side effects of the actual disease, that's going to actually help to clear that out as well.
You know, when you use tinctures, you use teas, you use extracts, or you use the raw herb itself, the raw herb has to be digested. We usually tell patients, at least I do, to take it with meals. But the tinctures and the teas and so forth are very, very different. I'm going to get into that a little bit. Before we do, I'd like to go to the phone lines. Robert, how can we help you, sir? Thank you for calling.
Hi, Dr. Roselle. I'd like to ask Dr. Pina's opinion. I've had a bacterial infection that my doctor says may be antibiotic resistant. He's tried a couple different antibiotics. But I went to a homeopath that gave me olive leaf extract that I've been taking for a little while now. What's your opinion of that as far as its action on killing bacteria that may be resistant to other treatments, and also is there any specific way to take it that would be more effective?
Well, a lot of time with olive leaf extract, you'll see in a couple of different forms, especially if they give you the recommendation, you're kind of left on your own to go get it yourself, is you'll either see it in an extract or almost like a tincture form, or you might see it in a capsule form if it's by itself. A lot of times also they'll combine it with some other herbs that might be more gentle on the stomach that kind of help break it down. It can work towards certain viruses and bugs and stuff, but essentially what we want to be careful of is that it's not overpowering on the system. Olive leaf, a very potent extract form, can be kind of almost leave you with a burning effect too. So if you were to take it, and even though it might be good for the situation, if all of a sudden you start noticing that you're getting a lot of indigestion or stomach ache and stuff, either you're going to have to back off on that dose, or else you're going to have to find a different form, or take it with food, or take it with something else, because with it in the stomach, it's still going to not just go after that one little, bug or parasite that's going on. It's going to essentially try to treat everything.
It's like any kind of antimicrobial, Robert. It's something that is broad spectrum and not necessarily specific. It has very high levels of antioxidants, and it's used for many things, not just that type of problem. So we test everything. We do neurofunctional muscle testing on things. We use acupuncture points. We use evoked responses to try to find out which herb is the best. But with olive leaf extract, although we do use it, and we do use it extensively in the practice, it's not necessarily a standalone herbal preparation, and it's also used, by the way, for fungal problems. So you can see it works on a lot of different things. So not knowing, what are you being treated for?
Well, I've had an off and on infection of the prostate, and that seems to be. And actually, I'm glad I asked that question, because I have been starting to have some upset stomach with this. So possibly it's maybe what you're saying here may be doing too much.
Well, it can be very, very effective with the prostate, but you also, with the prostate, you have to know what the balance is, what the pH is, and you have to shift. If the prostate is irritated and swollen, there's other pieces of the puzzle that you need to look at. It may be an inflammatory reaction and not a bacterial problem. If it's the prostate has a antibacterial or a bacterial problem, then you have to look at the bladder. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject. We're talking about herbs. That's right, herbal medicine, what you need to know and how to fix it yourself, and often you can, but you need to know how these things work, and that's the catch. In studio, Dr. Stephanie Pina, who will be your presenter this Wednesday evening at the Roselle Center for Healing for our in-house continuing education program. Understanding Herbal Medicine is the topic Wednesday evening. Give our office a call, 703-698-7117, 703-698-7117. Tell my staff you'd like to attend, and trust me, this lady has it all together. She knows more about herbal medicine than, it just kind of rolls. It just kind of flows. There's not too much you can ask her that she can't come up with an answer for. So, Dr. Pina, having said that and putting you on the spot, you better be good.
I hope so.
You will. You always are. You're always fantastic. Matter of fact, you're presenting Ageless Health 2012 around the corner, October the 20th. You're going to be one of our presenters, obviously, and you're going to be talking about the energetics of the body.
Yeah, this will be my third year presenting, and we're going to talk about We Are All Energy and really looking at how is it that, healers from the past and also even medicine now basically knew that there's more to us than just our physical being. It's not necessarily about all just mind, body, and spirit, but essentially we knew that there are ways of kind of using the body's energetics to heal on multiple ways. So it should be good. It's
going to be fantastic. I can't wait to hear their presentation. It's always interesting. You are always over the top. And October 20th is the date, Ageless Health 2012. We're rapidly moving to the direction of saying we're full. However, you still have a little time, and if you would like to register 2 people, you can go online to do that. Go to rosellecare.com. That's ROSELLECARE.com. And you're going to save $5 registration fee registering online because we don't have to handle the paperwork. And if you register 2 people, you will get an additional discount for 2. So get that done. Do it immediately before we're all sold out, which is coming rapidly. We're talking about herbal remedies today. We have flu season coming up, Dr. Pina, and we have the respiratory problems, and we have all of those things. So in the realm of herbal preparedness, if you will, what would you recommend and why?
Well, it's always interesting. One of the main things that a lot of people come in on already, and, they're doing things like vitamin C in the background. They're making sure they're hydrated. They're, working on their diet and stuff to make sure they're on a simplistic diet and trying to avoid things that might cause more stress to the body and the system. But one of the big immune boosters that you think of for respiratory is always echinacea. It's always around. People, a lot of times, when you go into this season, they'll start on it and they can stay on a lower dose of it throughout the entire season. Now, what's interesting is when you look at some of the, research and the side effects of echinacea stuff, that's kind of a contraindication because a lot of times they'll say there's that chance that echinacea boosts the immune system so much that if there's already immune issues, like, say, with autoimmune disease, or if the immune system's not functioning enough, that it might push it too far and cause some issues. What I like to tell people as far as with that particular herb, which can be used great in conjunction with other herbs too, because we know that we just don't want to boost the immune system. We want to help tonify the lungs as well.
Echinacea is another one of those thinking herbs.
Exactly. But what we want to do is we would want to take it as needed and then increase the dose if we're thinking something's coming on, and then kind of back off of it. So you don't want to necessarily be on it all the time, but you can use it when you're not feeling quite so right or you think something's coming on, just like you would do a lot of different things with your diet, with your lifestyle when you thought, I'm getting some fever and chills or my body aches and I just don't feel right. That's going to be the time to make sure you're making changes because that whatever it is already in your system. So you want to make sure you're really playing it up then.
Most herbs need to be cycled, and in my experience, you put somebody on herb for a period of a week or 2 weeks or a month, and at some point you need to take a break from the herb, whether it's 24 hours or sometimes a week, and then put them back on it. Echinacea is one of those, as you said earlier, particularly through the winter season, we're not talking about a long period of time here, that once you get the immune response up to where you want it, you take the herb down a little bit and you maintain a level that is supportive and continues to perpetuate your autoimmune function as you're trying to fight the viruses and all the nastiness that's out there, which, by the way, are there all the time. It's just your immune system's not working. It's being bombarded by the change in weather, the cold, the stresses of the holiday season. That's why everybody gets sick after the holidays, because you put more stuff in your body within a month's time, 30 days between Thanksgiving, Christmas, and New Year's than you would insult your enemy with, but you're insulting your body and it begins to crash on you.
It's interesting in Chinese medicine where you're doing a more of a mixed formulation versus one single herb. When you're evaluating a patient, you might see them at the very beginning or a couple of days into that illness. You essentially wouldn't give the same formulas that have the same amount of herbs on those first first through third day as you would from the third to the fifth day when things have progressed or they're not getting any better. And then when things got a little deeper in the system, you use a different formula as well. So things are changing up every 3 or 4 days. So if you're using the same formula at the very beginning of the cycle and then things keep progressing, that's not going to necessarily help the patient. It's going to slow down the process.
That's right. And it also tells you you're not hitting it right.
Absolutely.
Because if you're going after, so many of these herbs are antimicrobials, and they're very, very strong. They impact well, but they need other support mechanisms in parallel to them. So you have to be very careful how you apply these things. There's homeopathics, there's herbal preparations, there's tinctures, there's extracts. Understand the process. And if you want to understand the process, this Wednesday evening, Dr. Pina is going to go step by step. She's going to take you through it. She's going to give you the things that you need to, a divining rod, if you will, to be able to discern whether or not something is appropriate, how long to use something before you really need to get nervous about it. Call our office at 703-698-7117. Tell my staff that you'd like to attend Dr. Stephanie Pina's presentation on herbal medicine, and I promise you, our job and our commitment to you is to educate you, and this class is over the top. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We are in studio, 888-630-9625. That's 888-630-WMAL, broadcasting to you from 105.9 FM and AM 630 WMAL. Love to talk to you on any subject, obviously. Just give us a call. We'll handle it. We're talking about herbs, and we'll apply it to your particular situation, or we'll answer it in a very different fashion. And by the way, if you'd like to talk to us off the air, all you have to do is go to rosellecare.com. That's ROSELLECARE.com. ROSELLECARE.com. And send us a note, and we will respond. I promise you we will get to you sometimes. And by the way, there's a couple of people I need to apologize to. I was going through my spam mail the other day, and for some reason there were 2 notices, and it came back about 6 weeks ago that had got dumped in there. But I do clean them out, and I saw it, and I answered you, and I apologize, but I'm going to apologize again, because I always will get back to you, or one of my doctors will get back to you, and if it's something that is urgent, let us know that it's urgent, and mark it urgent in the subject line, and we will always talk to you. 888-630-9625, my guest in studio, your host and presenter, this Wednesday evening at the Roselle Center for Healing, Dr. Stephanie Pina, one of our most amazing colleagues. Dr. Pina is a doctor of naturopathy and an acupuncturist, and she knows her stuff. And we're talking about how to apply herbs, and she's going to talk about that Wednesday evening as well. Things that you should know about, how to make a decision when you're looking at something. When you have a cold or you've got something that hurts, is there something that you can do immediately that make a difference before you can see somebody? This is an opportunity, and I would encourage you to be there. Give our office a call, 703-698-7117, and tell my staff that you're going to be there. Remember what we've said in the past. We don't charge for these presentations. However, a reservation is necessary because many of you know you get to sit way out in the hallway, and we have to open both doors, and it's very crowded sometimes, but we do our best, and that's why we'd like the reservation. 703-698-7117. Dr. Pina, let's talk a little bit more about the different types of herbs. I use, as I said earlier, I use tinctures, and I use extracts, and I use teas more so than I'll use regular dried herb preparations. And I think that, from my opinion and my experience over the years, the potency, the energy behind them is much more significant. Your opinion?
I agree. I wish we were using more of them, and that's why you really start to see, in some of the larger stores that sell herbs, you see many more tincture bottles, little 1 ounce bottles of individual herbs out there. People want to know that what they're getting is coming from one quality product places, that they're getting clean herbs, but they're also worried about where the sources are and how to use them. So a lot of the times the extracts are kind of nice when you do have the ability to mix your own formulas. You can actually do quite a bit with an extract. You can make up a tincture for someone and then basically kind of tweak it for their personality and also for whatever their needs are as well too. The only thing that I usually run into with the herbal extracts, and this especially goes for some of the bitter Chinese herbs, herbs that they make, less extracts, but just regular teas. But, you know, there is a taste factor. Herbs taste like herbs. So, you know, when you look at some of these formulas, what they've done is they add in some what they call the energetic herbs to make sure that all the herbs in the formula get to where they need to go, that they can be digested properly, and then they might add things in like a little bit of cinnamon and licorice and stuff, which are, you know, have medicinal properties in themselves, but it actually kind of helps boost the taste a little bit too. So I think that's one of the main drawbacks with tinctures, but there's definitely a lot of things you can do with that.
You know, I said earlier that there are herbs that are put in with other herbs that are called thinking herbs. And basically what that means in a colloquial sense is simply that you use small amounts of certain types of herbs that you can call them smart herbs, like a smartphone. They target the infection. They target the organ system, and particularly with colds and flus and so forth, which we started upon before we made a break. There are things that are very, very potent that work very nicely. I want to get into some of the formulas with you in a minute, but let's go to the phones. Wilma, how can I help you? Thank you for calling.
Well, I have a real stubborn problem with flatulence, gas, and I'd like to know if there's anything in the herbal line that might give me an aid.
Is food triggering it?
I don't think so. I think it might be medicine.
Okay, well, then that's a whole different story. If you're dealing with a medication that's causing the problem and an imbalance in the intestinal system where you're, gas buildup in the intestinal tract can come from a lot of different things. It can come from an incomplete digestive process where you're not producing enough hydrochloric acid in the stomach or enough digestive proteolytic enzymes from the pancreas or enough bile, and so it can't break everything down. So essentially what happens is the food sits and rots in your intestinal tract. The other thing is that if you have high levels of mold or fungus or yeast, that can happen. If you're eating, if you're constipated and you're not moving things through, then the food stagnates in your gut and you're going to bloat. Not only are you going to have the toxicity and overwhelm in your system, but you're also going to have gas buildup and putrefaction. Dr. Pina.
Well, the great thing about that, too, is where we just talked about how foods and medications can be the source of some of this stuff. You can also look at the fact, too, is that sometimes herbs will help and sometimes you have to use it in conjunction with, say, some other supplement or changes in the diet. It works well integrative with everything else as well. Some of the herbs that are good for digestion there, because it could be even a little higher up in the stomach, and that's where the issues is, or even just some of your basic peppermint and spearmints, as long as you don't have any kind of allergy symptoms to that, that can kind of help be cooling to the stomach if there is inflammation that's causing some of that gas and stuff too. And then also making sure that you're having regular bowel movements. If you're not having regular bowel movements, you're going to have some of that gas buildup, and making sure that some of the herbs like your sennas and even cascaras and stuff that you can take as a tea version versus a tincture version in that case can actually help kind of get things moving as well. But you want to make sure that if there's something going on in the digestive tract, what's causing it and what other things should we be replacing that make sure that the gut's working well first.
And going back to what I normally say when somebody asks about constipation, the first thing you look at is water. You should be drinking half of your body weight in water every day and breaking it up, over a period of the entire day. Add a little lemon to it and it'll help gently detoxify the liver, which will also help move things along. What type of medications are you taking?
Lithium.
So, you're taking lithium. That's going to slow things down all the way across the board. So that I don't think is going to cause the flatulence. I would look more to digestive, but the thing of it is that can cause constipation, which will cause the bloating, the gas, and so forth. So I think there's multiple things that have to be considered there. There's some natural lithium products called lithomin, and it's the actual whole herb and extract instead of just the extract of the medication. But you really need to be in somebody's hands that knows what they're talking about, like Dr. Pina. She can help you with that. But we'd have to know a whole lot more about you. How old are you?
I'm 68. Okay,
so the possibility of your digestive system not working properly is, probably pretty high, because when we hit 60, we produce about 30% of the hydrochloric acid in our stomach that we did when we were 20. And we need that to break things down. So if we're getting things now, if you're eating things, I'm just giving you a mantra. I'm not going to, I'm not specifically pointing my finger, but sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, additives, preservatives, all of these things can cause the intestinal tract to shift. And because of that shifting, you're going to have inadequate digestion, you're going to have permeability of the intestinal tract, you're going to have bad absorption, you're going to have more allergic reactions, which are going to produce the gas. So it's, in your particular situation, it's more of a broad-based thing. But you can do some of the things that Dr. Pina talked about. Make sure the water's there. Get a very, very well-refined bulk former from one of the health food stores. Make sure that you're taking a good probiotic. You can supplement with a broad-based digestive enzyme, particularly proteolytic enzymes. See if that helps you. That should make a difference. If it doesn't, then, Wilma, give us a call.
Okay. Thank you very much.
Thank you for calling. 888-630-9625. My guest in studio, Dr. Stephanie Pina, who will be your presenter this Wednesday evening, the 19th of the month at 7:30 p.m. We'd love to have you as our guest, 703-698-7117, and tell my staff that you'd like to be there. Dr. Pina is a doctor of naturopathy and has a very significant understanding of herbal remedies, both from the Chinese herbs and American herbs, because she is, well, a acupuncturist. So, Dr. Pina, let's talk a little bit more about the upcoming flu season. And we said a little bit about echinacea and the things that go along with it. And by the way, shifting from an herbal remedy, but if you combine echinacea, vitamin C, and zinc together, it's a very, very strong immune booster and may get you through that season, particularly if you're very if you're stalwart and watchful about putting the things that we just talked about, particularly coming up to the holidays, and that's when we really get sick. But if somebody gets a cold, if it's a respiratory problem, if it's in their lungs and they're hacking and they're spitting and they just can't get rid of it, they hear the bronchitis, it's not a pneumonia, what do we do?
Well, one of the things is you probably, especially if you have any kind of fear with that's a high fever and stuff, you want to be seen. You want to make sure that you're not spreading it to other people. But essentially what you can do is also you do want to boost things that in the immune system, but you want to help get some of that phlegm out. In Chinese medicine, there's a formula that essentially has some herbs, and one of the main herbs also that works specifically for the lungs and also for the immune system is astragalus. And a lot of times you see astragalus as a tea by itself. You can actually see the raw herbs in some of these stores. It kind of looks a little bit like a tongue depressor, actually. But you can make some of those teas and then actually combine some of that raw herb actually in with, really basic, soups and meals and stuff, so you can actually eat the herb or strain it out and stuff. So there's a lot of other things that you can do to help out with the respiratory tract, but you want to actually give something that's kind of soothing for the lungs. One of my favorite things that used to come up a lot, too, is when you look at a different type of way using herbal preparations is homeopathically. There's a lot of homeopathic remedies that you see now that you have available in some stores that will have respiratory conditions on the outside. So say if someone's got phlegm that kind of keeps coming up and getting stuck in their throat, that might be a Cali Bic or a Cali carb. Homeopathy in itself is being very specific on what you're doing, so you have to work with someone for that. But there's a lot of different herbal combinations, one being a formula called oscillocynum. I always pronounce that wrong because it's a weird homeopathic.
I'm not even going to try because,
It's a mixture, but basically what people do is they can take it almost two ways. Sometimes people will take their little pellets to dissolve in their mouth that doesn't have any taste, so that's nice compared to some of the tinctures. But what they do is you can take them when you're kind of feeling some of these cold flu season symptoms coming on, and you usually come in a number of different vials, so it's nice so you can take it for those first 3 days. Or someone will take it at the beginning of the season. If they do decide to get a flu shot, they'll take it with that to kind of help counteract some of the side effects from the flu shot. But you'll see that throughout the season. All the stores tend to stock way up on that stuff whenever we get closer to the end of the year.
Yeah,
so.
There's a formula out there that I use in the office for a lot of respiratory problems, and patients will call in and they'll tell me, what do I pick up? And one's called Clear Lungs, and it's from Ridgecrest Herbals, and it works very, very well. But if it doesn't work within a period of about 4 days, then it's not going to work. Usually 72 hours you're going to start seeing some shift and some change. It has a lot of different things in it, and the balance is really important. It has dong quai in it. It has asparagus root. It's got immune system boosters to remove the junk from the respiratory system. Now, there's Clear Lung Red and there's Clear Lung Blue. The Clear Lung Red actually will cause you to bring up the stuff that's in your system. Very, very significant herbal preparation. So you have to be careful with multi-herbs, because if you take an herb, by the way, and things get worse, or you start feeling poorly, or you end up with other symptoms that you didn't have before, I mean, in a quick situation, meaning within a few hours of taking it, it's not that the herb is taking you through a resolution of this thing is actually causing a problem, and you need to stop that and call somebody who really knows what they're doing. But Clear Lung actually works quite nicely. We're going to get into that. Lungswort, by the way, is one that I like to use and have always combined it. Lungswort with golden seal, the herb itself, and I put those together and make a hot tea out of it and steep it. That is a very, very excellent remedy. You're listening to Dr. Tom Roselle Live. We've been in studio at 888-630-WMAL. Don't forget, if you'd like to contact us off the air, you can do so by going to rosellecare.com. That's ROSELLECARE.com. And send us a note. We will get back to you. Tell us that we need to call you. We'll do that too. One of our doctors will always talk to you and take the opportunity to do that. These in-house continuing education programs were designed to offer you the most up-to-date information on multiple topics. This one on understanding herbal medicine that Dr. Pina is going to present this Wednesday evening, the 17th of the month, is truly cutting edge. It's amazing. You're going to learn a lot that you didn't even think to ask the question about in herbal medicine. So I would encourage you, please attend at 703-698-7117, the Roselle Center for Healing. We're located in the Red Cross building, just off the National Capital Beltway on Route 50 in Fairfax, about a third of a mile. You get off and you're there, and it's real easy to get to. 7:30 we start promptly, and we will be there to answer your questions afterwards. Dr. Pina, give us a little thumbnail of what people can expect this Wednesday evening.
Okay, I'm going to do a quick correction because it's going to be on the 19th, on Wednesday the 19th.
What did I say?
The 17th.
Forget what I said. It is the 19th. Yes.
Wednesday the 19th, 7:30.
Do I have something going on the 17th?
I don't know, but I'm not even in the office that day, so that's going to be an interesting lecture.
That's tomorrow, right?
Yes.
Okay, so never mind what I said. It's the 19th, Wednesday, 7:30 p.m.
All right.
See, now everybody knows the program is live.
Yeah, exactly.
Yes, okay.
It's going to be a little different than we usually are used to. You know, we're going to talk about how herbs have used in the past, how they're using now, how you can go into a store and basically be a little bit more familiar with the different types of herbs that are out there. But it's also going to be a hands-on lecture. We're going to be tasting and touching and using our senses to kind of understand herbs in a little bit of a different way. That might lead to some interesting concoctions and stuff, but we're going to basically kind of break down herbs so you can understand when to use what types of herbs, and then also what might make a good first aid kind of kit as far as herbal goes when you're in desperate need of something.
Sounds like fun.
It should be. Lots of tasting.
I will be there, at least for part of it. I have to travel this weekend. I'm teaching in Toronto, then teaching in Chicago over the weekend, so I've got 4 days of fly time around. But your presentations are always ones that I like to be at because they are so impactful, so informative. I always learn things when I listen to you. You're very, very knowledgeable doctor, and tremendous amount of information overflows, as they say. Want to tell you about something special coming up besides Ageless Health 2012, October 20th. Please don't forget to register for that. You can go online at rosellecare.com, and it's all set up for you. Just go in, click, bang, you're all set. You'll get an acknowledgement from us that it's going to happen. But, you know, let me put it to you this way. If you really care, if you're really serious about changing anything in your life, this is an opportunity for you, because I promise you will go away with a guide, step by step, of how to implement, do what you need to do. You're going to learn about core training exercise as you're coming in and you're registering for the class. There's going to be demonstrations on stage. We're going to kick it off early in the morning. Dr. Evan Mladenoff is going to be there. He's going to talk about the psychological end of healing, the mind-body connection. We're going to get in. Dr. Pina is going to be talking. Sue's going to be presenting on how to eat properly in a stressful world. Dr. Jen is going to be presenting. We're going to get into the afternoon, and Dr. Browning, who's always powerful in his presentations, will be talking about a neurological linkage to a lot of your healthcare problems, and Dr. Poe and Dr. Lamp, and it just bang, bang, bang. At noontime, when we break for lunch, we're going to provide for you a organic lunch, and you're also going to see a demonstration on Tai Chi Guan. Join us. Go to rosellecare.com and register. Have a new website in the process, and it's going to be about what we're doing, lectures, and all kinds of other things. I'll tell you about that as time goes on. This program goes way too fast. There's so much more that we'd like to extend to you and to give to you and provide knowledge-based information so you can apply it for yourself, for your family, and stay healthy and take control of your life, because trust me, in the oncoming months, you're going to need to take control of your health. Health is a do-it-yourself program. See you next week at 12 noon. This is Dr. Tom Roselle. Bye. Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Did you know that breast cancer is on the rise and that routine annual mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? The result could increase the risk of developing breast cancer. Now, consider a simple, non-invasive, and totally safe adjunct medical procedure approved by the FDA, which can detect evidence of breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect initial signs of breast cancer, such as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call Thermography Centers at 888-485-7736. That's 888-485-7736. And for more information, visit thermographycenters.com.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and include a thermographic breast scan as part of your annual wellness checkup.
Are you looking for great tennis instruction in a dynamic, challenging, and fun environment? Hi, this is Dr. Tom Roselle, inviting you to visit rjtennis.com to learn about the most popular adult tennis program in the metro area. RJ Tennis programs are packed full of energy and non-stop tennis. With exhilarating drills and games, RJ Tennis will energize your game, fitness, and life. So call a friend and sign up today at rjtennis.com. That's rjtennis.com.